unmute.
Oh.
If you have a question, you can go ahead and put it in the chat. I'm going to give everybody the capability to unmute themselves. If you do need to jump in for anything, you know, maybe I have a fly on my nose or, you know, something like that. You just gotta jump in and say, hey, get the fly off your nose. Anyway, so I did put everybody on mute. Oh, it doesn't seem like it's muting everybody. Let's see. Let me double check here. Maybe the reason why is because people keep on joining. Okay. All right. So everybody is on mute. We've got a nice group of people here today. And if there's any questions, you could go ahead and throw it in the chat. Sharon and Patricia, you can go ahead and monitor that chat. Amber, you can keep an eye on it as well. Francis is here. Francis is real good to monitor the chat. We don't have Lou and Joyce. So, you know, if you guys could keep an eye on that chat for me. After class, we're gonna go ahead and open it up for questions. And then after class, of course, we're gonna do a giveaway. I've got some cool little keychains. And those of you who are not new to this class already know, these keychains have, I believe it's eight vials inside. And these are all little, you know, sizes that you could take. You can get it through TSA. You can put it on your keychain and, you know, carry it around with you on your backpack, your purse, whatever. But anyway, I'm going to go ahead and give 2 of those away after class. I want to welcome everybody out. I kind of had some fun putting this class together. So the class, the title obviously is Ancient Secrets of Essential Oils. So I'm also going to be recording the class. So if there's anything that you miss, it will be on YouTube later on today. I'm also just going to suggest that you get your phones out because there are going to be some things that you might want to take some pictures of. And so, you know, different recipes and, you know, essential oil blends. So anyway, if I'm going too fast, you can go ahead and jump in as well. Tell me to slow down. I do tend to talk fast, but I also like through the content. And then of course, like I say, we'll, you know, open it up for questions afterwards. So anyway, so since ancient times, and as near as we can tell from the beginning of recorded history, the plant kingdom has provided rare and powerful extracts and essences that have long been prized for their beauty enhancing, medicinal, spiritual, aromatic, and therapeutic value. Aromatic plants, essences, and oils have been used for ages in ceremony, religious observances, beauty care, food preparation, preservation, incense, and as perfumes. Aromatic plants have also been the basis for herbal and botanical medicines and remedies for thousands of years. In fact, they're the root of today's pharmaceuticals. We're going to talk about that in much more depth in just a few minutes. But I do wanted to talk just a little bit about the history of these awesome oils that we're going to talk about later on. The earliest essential oil usage evidence occurs in the period 3000 to 2500 BC or before. A brief history, all right? So maybe we could look at Egypt being maybe one of the oldest civilizations. Those of us who read the Bible understand that Egypt is in the Bible very early on in biblical times, but as early as 2000 BC, the ancient Egyptians were using essential oils for medicinal benefits, beauty care, spiritual enhancement, and in literally all aspects of their daily life. As a matter of fact, I'll back up for just a moment. In these great tombs of the pharaohs, one of the things that was very interesting to have actually learned was that these these pharaohs, they were buried with many treasures, gold, silver, and different oils, such as frankincense and myrrh, maybe cassia. And they found that, after many years, of course, grave robbers, as they do, go in and they try to take whatever is valuable. And one of the things that they found that was very interesting was that the frankincense was taken more so than the gold was taken. In other words, frankincense at this time was considered more valuable than gold. We're going to talk a little bit about frankincense here in just a few moments. Greece. Now, much of education that became part of Greek, Roman, and Jewish culture was derived from the Egyptians. Hippocrates, the Greek physician, whose influence still informs the the medical community. And that was one thing that I did learn about as I was in school was, Socrates and Hippocrates and Aristotle. They were very influential in some of the medical writings. But this Hippocrates was considered the father of modern medicine. Among other things, he studied and documented the medicinal influence of over 300 plants and is reported to have advised that the way to health is to have an aromatic bath and scented massage every day. Wouldn't that be nice now? He reportedly believed strongly in the medicinal benefit of fumigation with aromatics and used fumigation in the city of Athens to combat the plague. Now, isn't that interesting? We're going to talk a little bit about the plague in just a few minutes and how the fumigation and the aromatics, because essential oils weren't always called essential oils. So Hippocrates also prescribed aromatic treatments for fallen soldiers on the battlefields. And we're going to talk about that also in a few minutes. All right. And from Greece, of course, where do we go? I think everybody probably knows what would be the next civilization. And I don't know why this came up. Let's go ahead and drop that down. Okay. All righty. Okay. So that's right. I'm sorry. I was thinking I was going to move on to Rome. But before I moved on to Rome, I did want to stop and talk about the Black Plague because, as I mentioned, Hippocrates had talked about fumigating all of Greece with aromatics during the Black Plague. Why? Well, let's read. During the Black Plague of the 17th century, every aromatic substance available seems to have been used. Hang on, let me admit somebody's trying to get in. Okay, I'm sorry. So during the Black Plague of the 17th century, every aromatic substance available seems to have been used. Aromatics were the best antiseptics available at that time. And the people knew it. Of course, it didn't help many thousands of people who had died, prior to getting in contact with them. But those that were in the closest contact with the aromatics, especially the perfumers, were virtually immune. Now that is very interesting. We want to talk about that a little today. One of the things, as you can see here with the picture of this man with the beak, and I know a lot of times, people are very, they're very scared by this picture. But this was a common sight. The reason for the mask there was that this particular, whether he was a pharmacist or whether he was a mortician, whatever he might have been, he wore these masks stuffed with herbs. And as he would breathe them in, that was actually helping with the combat and prevention of him getting sick. Notice how he's covered from head to toe. Now, of course, we're in a pandemic right now, and if we saw somebody walking down the road with this, we'd be a little taken back. We just wear a simple mask, right? If we wear anything, right? And so, but this is, the Black Plague, which was virtually killing, I think 1/3 of the population of Europe actually died at that time. But anyway, I just thought it was very interesting, the way that these essential oils were used during the plague. Okay. And next, we're going to go to India. Essential oils have been a core element to the Indian Ayurvedic healthcare system, a natural healing system blended spiritual, philosophical, and practical elements. No one is sure exactly how old Ayurvedic medicine is. We understand that it's been practiced for at least 5,000 years, is widely practiced in India today, and a principal tenet is aromatic massage. Sounds wonderful. Ayurvedic literature from 2000 BC records Indian doctors administering oils of cinnamon, ginger, myrrh, coriander, spikenard, and sandalwood to their patients. We're going to talk a little bit about, some of the prescribing of these oils to patients in just a couple of minutes. And I think you'll find it very interesting, to say the least. Rome. The Roman culture was deeply influenced by the Greeks, with influences that were heavily interwoven through centuries of war. The Greek influence is most apparent in architecture and healthcare. When it comes to aromatics and health, more than any of the other cultures, the Romans use aromatic materials and essential oils with sheer extreme and decadence. They bathed with them lavishly, several times a day, and had frequent massages with essential oils. Oils were also used to scent the hair, the body, and the bed. Now, one of the things that I noticed about the essential oils, and I was a couple weeks back, I was using On Guard because I don't use the antiperspirants just because of how harmful they are, the aluminum and just all the scares with breast cancer and everything. I've decided to go to a natural way to take care of, of course, everybody uses something under their arms, right? Because you don't like a smell, or nobody likes to sweat, but very important, actually, it is to sweat under the arms. There is a lot of lymphatic drainage that happens under your arms. So what I was using and what I'm using now, which I might go back to, I used to use On Guard every single day. I would use it all along the lymphatic, on my neck, my shoulders, under my arms, just all down. You've got your major lymphatic drainage is going right down. It literally goes right along with your aorta. It actually, it travels right along the same path. And so those were the areas that I put the On Guard, which is great. However, I've been doing On Guard internally right now. So what I switched to is I've been using geranium. And boy, let me tell you, geranium does the trick. Absolutely love the smell. So like I say, when the Romans, they were using the oils to scent the hair, the body, and the bed. Remember one thing, they didn't have any perspirants back at this time, right? If you sweat and you smell, that was it, right? So they would use these aromatics to cover up the smell, but not, obviously there was nothing that they could do to prevent you from sweating. And we've got, these advances in things today, supposedly advances, that are actually bad for us. And so geranium is wonderful for scenting. I put it under my arms, I put it on my neck, put it on my shoulders, and I smell it almost, a good part of the day I'm smelling it. It smells wonderful. But anyway, the most exotic oils available at that time were blended by highly skilled perfumers, creating celebrated fragrances. A prominent Greek physician, a doctor for the Roman army, Pedanius Dioscorides, I can't pronounce his name, he wrote an impressive 5-volume reference work on herbal medicine during the 1st century AD, with well over 600 remedies in those publications. So basically, the whole point is there were very many remedies that were actually proven that they work, right? And also, very useful. For example, myrrh is helpful with gum infections. Well, we still use myrrh for our gum care now. If you're buying, of course, if you use doTERRA toothpaste, there's myrrh oil in there, which is very, very good for your teeth and for your gums. So myrrh is helpful with gum infections. Juniper berry is a well-known diuretic. And marjoram has sedative effects. And then cypress, very good for relieving diarrhea. So anyway, basically what I'm saying is that these oils, it's not like this is some kind of a new discovery, right? These oils have been used for a long time. And I apologize for the bad graphic in this one, but China, herbs and plants, now we know that China is, they're well known for their teas, but in China, herbs and plant medicine are an integral part of traditional Chinese medicine. They're also an important part of Chinese folk medicine. Specific use of essential oils have been traced to before the time of Christ. The oldest surviving medical text that we're aware of is the Shennong's Herbal, which is dated around 2700 BC, containing information on usage of 365 plants. You oftentimes you see Asian people digging in the ground. I know I just saw somebody just yesterday, and I tell you, I would love to, whenever I see it, to just stop and go and ask, what are you looking for? What are you digging for? Because I know it's something beneficial. And it's usually somebody from the older generation that's doing that as well. They understand, the benefits of herbs, right? So Shennong was a ruler, father of Chinese herbal medicine, and a cultural hero of China who taught his people the practices of agriculture. He consumed hundreds of herbs to test their medical value and is said to have discovered tea and to be the father of traditional Chinese medicine, including acupuncture. Now also with the Bible, we find many essential oils mentioned in the Bible, both Old and New Testament, have dozens of references to aromatic plants with at least 12 essential oils mentioned over 9 times respectively. Essential oils and herbs that are specifically mentioned in the Bible include cedarwood, frankincense, fir, cinnamon, myrrh, myrtle, and spikenard. All right, getting close to the end of the history, and I hope everybody's learning something here, because I certainly did. But how about Europe? During the Middle Ages, Hippocrates' wisdom and the use of aromatics was denounced by the Catholic Church as decadent. Bathing for healing or the cure was deemed inappropriate. This temporarily reduced the use of essential oils therapeutically, although they were kept for use in their pleasant aromas. History seems to point to the monks of that era for secretly keeping plant medicine and wisdom alive and well. Although the threat of persecution or being burned at the stake was ever present, the use of herbs and essential oils was labeled witchcraft. Many lost their lives or were outcast from their communities during that time period. By the 1600s, writings about herbal medicine and essential oils became widespread. By the 1800s, most of pharmacopoeia of England, Germany, and France were referencing and, pay attention, prescribing essential oils for a variety of illnesses. When was the last time you went to the doctor and he prescribed you frankincense or tea tree or lemon? These are actually oils that could be prescription strength in many cases. Many people don't believe that, but it is true. What is prescription strength anyway? We're going to talk just a little bit in just a minute. At the same time, large flower growing districts in the south of France were supplying raw materials for French perfumers. Tuberculosis was common, yet workers processing flowers and herbs generally remained disease-free. Isn't that beautiful? I would love to work in a flower garden all the time, picking flowers. That would be absolutely wonderful. Believing that essential oils in the plants were protecting the workers, the first recorded lab test of the antibacterial properties of essential oils was performed in 1887. And this is the man, René Maurice Gattefossé, a French cosmetic chemist, severely burned his hands and his arms in an accidental lab explosion. He extinguished the flames, but as he described it, both of my hands were covered with rapidly developing gas gangrene. Anybody know what that is? Gas gangrene, where it's actually eating away at your flesh and you cannot stop it. He submerged his burns in a large container of lavender oil. Did he have any idea that the lavender would help? I don't know. but he reported that just one rinse with lavender essence stopped the gasification of the tissue. This treatment was followed by profuse sweating and healing, which began the next day. Although he previously had no interest in natural healing methods, his astonishing burn experience led him to investigate the medical uses of essential oils by treating soldiers in military hospitals during World War I. He coined the term aromatherapy in the 1920s and the 1930s, the treatment of disease and injury using aromatic essential oils. That's what aromatherapy is. Aroma is the smell. Therapy is how it acts upon the body. So it smells acting upon the body. What an amazing, it's like, I mean, we would have no idea. We think of aromatherapy, we think it's just nice smelling things. No, people in other countries really understand aromatherapy to be treatment of diseases by those nice smelling things, right? The nice smelling, it's just incidental, but it's very important to, you know, I know to my nose it is anyway. What about Jean Valnet, a Parisian medical doctor and army surgeon who was also a colleague of Gartenfous? He began to use essential oils with great success as antiseptics treating war wounds during the Indochina War from 1948 to 1959. As the story goes, he was in China treating war wounded when he ran out of his supply of antibiotics. Out of desperation, he began to use essential oils on the injured. He was amazed to see how the essential oils fought infection, crediting many lives saved due to the use of essential oils. It's pretty incredible, pretty incredible. He incidentally, or accidentally, I should say, found out that essential oils can actually treat infection. After the war, he continued using essential oils in his practice, publishing in 1964 the comprehensive text, The Practice of Aromatherapy, earning him global recognition and providing impetus for further interest, study, and discovery. Now, last man I want to talk about is the French MD. His name is Daniel Pinot. He was along with the French biochemist Pierre Francombe. He investigated and cataloged the medical properties of over 270 essential oils, recommending use for a clinical environment. They then co-authored a reference book listing the medicinal properties of those oils. The book, published in France in 1990, L'Aromathérapie Exactement, quickly became the primary reference book for secondary authors researching and writing of the medical benefits of essential oils. Very interesting. I hope it was interesting to you as well. Now, these two pictures, they're pictures of store windows actually in France. I want you to take note. The word aromatherapy is noted in both, indicating that you can buy essential oils in these particular pharmacies. Now that's very interesting because in our pharmacies, all you're finding is, you know, amoxicillin and all of these different, we're going to talk a little bit about amoxicillin. That's why it's top of my head. But you look in the back and it's all just white bottles usually of, you know, these synthetically created pharmaceuticals, and many of them are actually fashioned after some of these essential oils. That's for a whole nother topic and a whole nother class. In Europe today, in France, Germany, and England, it's common for doctors to offer a choice when prescribing remedies for a specific health condition. Patients can choose either prescription medicines or natural essential oils. Wouldn't you rather have a choice than for a doctor to tell you, this is what you need to take? I would much rather have a choice. And of course, most often I would go natural. Both are distributed through pharmacies across Europe. So it seems as though maybe we're just a little beyond the times in this regard. So essential oils have not only stood the test of time, they have proven their efficacy and effectiveness on every level. Tradition and historical records provide proven insights and understanding of how essential oils were used in the past and how they can benefit our lives today. Happily, with the renewed interest in essential oils and the resurgence in their use, there are many, many new clinical studies and publications documenting the efficacy and benefits. Aromatherapy is now becoming a powerful bridge between cultures, modalities, and healthcare professionals. And I want to introduce those who might not have ever seen. This is my go-to. It's a very large book. Matter of fact, I was just looking at something today, and in here, so I have my little bookmark on the integumentary system. But this particular book, what it does is it highlights it highlights particular essential oils and all of the uses. This is just one essential oil. There are many contained in this book. And then it also will highlight different conditions and the oils that can be used for those particular conditions. Okay, so this book is a must-have. There's actually a newer edition out. I particularly prefer this one, even though it is the older edition. What edition is this? Who knows what edition this is? Let me see. It says in here somewhere. This is the second edition of the Modern Essentials. However, I think they're up to like maybe the 5th edition. The 5th edition is more current. I like this one because I absolutely love the pictures, and I do have the newest edition, but I love seeing the pictures in that particular book there. Okay, so in the recent years, both doctors and the public have rediscovered the medical value of essential plant oils, but the idea of using their properties to maintain or regain health goes all the way back to antiquity. The Romans had their knowledge of essential oils from the Greeks, who in turn received it from the Egyptians. For example, Hippocrates. He tackled the plague epidemic, like we talked about in Athens, by fumigating the whole city with aromatic essence of plant oils. So if you didn't hear me say it earlier, it definitely repeats, or it deserves being repeated. The plague was actually fought using essential oils, although at that time they called them aromatic essences. Later in the 19th century, it is known that perfumery workers always showed an almost complete immunity during cholera outbreaks. Very interesting information, if you ask me. All right, the way most doctors practice medicine right now is in working. It's taking one problem and you're tackling that problem, but you're creating other problems. So is it really working? We're going to talk about that a little bit more in just a minute. Medical students are trained to see the body as a collection of isolated parts instead of one whole system. That's why that term holistic approach. It means you are approaching health through the entire body, from within and from without. Okay, so it's very, very important. It's not only, getting out in the sun, getting some fresh air, getting some exercising, eating healthy, drinking good, clean water, using essential oils as preventative medicine, supplementation, all of these things. That's a holistic approach to health. Not only that, is oftentimes people are treating pain just for the pain. You got to find out why you're getting the pain. It's very important. We're going to talk a little bit about pain in just a minute. But ensuring that we move forward medical specialization, organizing medicine by organs and diseases, by location and symptoms is flawed. And as a result, modern medicine is at a breaking point. Okay, you can't just treat it just one organ at a time, because one organ affects another, such as your kidney. Does everybody understand that your kidneys literally help to regulate your blood pressure? So if you maintain your kidneys, you're also in turn maintaining a healthy blood pressure. Essential oils are especially valuable as antiseptics because their aggression toward microbial germs is matched by their total harmlessness to tissue. So whereas they attack bacteria or viruses, any type of microbial, it does not attack our good, healthy tissue. That's really, really interesting. One of the chief defects of chemical antiseptics is that they're likely to be as harmful to the cells of the organism as to the cause of the disease. such as if you're taking chemotherapy for cancer. You're not only killing the bad cells, which is good. I mean, you got to be aggressive sometimes with cancer. However, you're also killing the good, healthy tissue. So you're left with residual problems. And we actually have somebody who's a cancer survivor on the call, and she might be able to give us a few words at the end of this class, as to, how what she has learned through this whole thing. Now also certain aldehydes, which they're found in some essential oils, they've been shown to reduce inflammation, while certain ketones in rosemary and eucalyptus appear to reduce mucus production. A good friend of mine, she's actually a Christian, she's dealing with a lot of coughing right now. And she said she doesn't believe it's COVID. She just believes that she's having a really bad allergic reaction. So I told her eucalyptus and lemon, get it on your chest several times in the day. It reduces mucus production. Essential oils appear to affect the emotions as well. In one recent study done in a British nursing home, vaporized lavender oil was found to work as well as pharmaceutical sedatives in helping residents relax into sleep. Let me repeat that. Lavender oil being diffused was shown to work as well as pharmaceutical sedatives to help people relax and to sleep. That's big. That's really big if you ask me. Alrighty, so today's dilemma, we live in a culture and we have been led so far away from all things natural, right? We've got herbs, we've got plant nourishment, we've got essential oil, we've got restorative plant intelligences. How many times when maybe you're going, maybe somebody's going to the doctor and, they're borderline diabetic, what is the doctor telling them? Get more vegetables, lose weight. Having your nutrition through vegetables, through herbs, and it's very difficult. I've been keeping a food diary, and I mean, literally, I can only get 4 servings of vegetables in a day. They're big servings of vegetables, but I've been steadily maintaining 4 servings of vegetables in a day and 3 servings of fruits every day. You can actually even eat more than that. But that's about all I can, I just can't fit in any more than that. But instead, we've been led to obey without question our doctor and the medical profession in general. While there may occasionally be a time and a place for meds and of course, doctors more often than not, we understand that natural elements, specifically pristine essential oils, can help the body to resolve many of the health challenges that we face. So turning more to nature, very important. All right, so this is what I wanted to talk just a little bit about is pharmaceuticals. Now, how many of us have had children? I've had a number of kids. Amoxicillin was literally something that was always in my refrigerator, right? And the kids called it the pink medicine, right? They got it all the time. Why? Because the doctors were constantly prescribing medication. Look at the side effects: nausea, vomiting, diarrhea, thrush, vaginal yeast infection, vaginal fungal infection, discharge, dark urine, abdominal pain, yellowing of the eyes or the skin, easy bruising or bleeding, sore throat, persistent fever. I mean, my goodness. The side effects, sometimes you want to say, are they really worth it, right? But we are literally living in a drug addicted culture. We've got to go back to the ancient way of doing things. So the dilemma for many in today's world is that from the time children are infants and develop their first earache, and I raised most of my kids in Alaska while they were little, and one of the things about the cold weather, what happens is it dries out our nasal passages, dries out our throat, and that dryness is what actually allows viruses and bacteria to easily pass. It's when you've got the healthy mucus buildup that it literally, mucus is there for a reason. It traps the viruses, it traps the bacteria. That's why with COVID, your best defense against COVID is to have a healthy mucus membrane in your nose and in your throat. How do you do that? You've got to keep diffusers, humidifiers running. And then of course, having the essential oils in there to literally kill viruses and the bacteria. Very, very important. So anyway, getting back to, being up in Alaska where it was a lot drier, the colds, viruses, ear infections, all those things were constantly going around with the kids. But we have been culturally indoctrinated, expecting to just put our kids on amoxicillin. Like I say, my kids were constantly on amoxicillin. The journey of the Western medicine drug culture treadmill begins. First, you take the amoxicillin for their earache, and then some form of medication that has to now counteract the thrush that the kids get from the candida or yeast overgrowth. So it's like one thing causes another, then you got to take another thing, which causes another thing, right? And that's where that treadmill cycle continues. So, drug-free America? Hardly, you got the babies on amoxicillin, the young children on Ritalin or Prozac or whatever not Prozac, but what else do they take for ADHD or autism and all of that? Then you've got the preteens and the teenagers on appetite suppressants, the teenagers and the college students on NoDoz, and the crazy, busy mamas on Prozac, and the older disgruntled men on Zantac to take care of his anxiety, and then the 65 and up group taking everything else, right? This is the society that we live in. This is the society we live in. And I don't fault anybody. If anybody is out there that's on medications, there are going to be the times where you absolutely must take them. But one of the things that I say, and that I'm trying to do for my own self, is I want to try to prevent myself from having to take all these medications. I want to try to keep my body in tip-top shape so that I don't have to, eventually be on all these medications as I get older. I know I'm going to get older, and, every year I just turned 54. So, every year it's the years are creeping up. So I know I'm getting older, but I don't want to feel like I'm getting older. So I want to try to stave that off as long as I possibly can. And I must say that taking essential oils regularly really helps. So the bigger problem is over time, less time for some than for others, the repeated use of prescription drugs dulls our senses, deteriorates our bodies, drains our life force, drives up insurance costs, and in some cases generates addictions, and basically contributes to very little for overall vitality and wellness. Yet it does contribute to dependency on more meds, rapid aging, and dullness. The trouble is, the plant-based and essential oil and herbal remedies that have been used for ages have been relegated to the alternative section of Western healthcare. Anyone who doesn't march to the beat of the Western medical model is hassled and potentially labeled as a contrarian, taking responsibility for our own health, and that our children seems to have been culturally categorized as some sort of non-compliance. Now, I do know that it is getting more popular today, and I'm thankful to be a part of that drive, part of that movement, and I'll continue to be. In my life, as I learn, that I'm going to go ahead and teach it to other folks as well. So the good news is that on the flip side, we have plenty of scientific evidence that the health needs currently being met with most over-the-counter or prescription meds can be fulfilled in a more balanced, health-promoting, and life-giving way, with high-frequency, life-giving, pristine, essential oils, plant medicines, natural elements from the earth. So consider the possibility that for centuries, effective pain relief came from nature, right? Working in harmony with the body. I think that's very, very important. A lot of the prescription meds, they work against the body. Well, they might alleviate the symptoms, but how many of them actually cure the problem? So the same health promoting benefits are available to you and to me by using nature's pharmacy. Notice how that word is spelled F-A-R-M, pharmacy. Not only are they safe, effective, affordable, non-toxic, natural solutions for many who might have previously risked their lives and health with toxic meds before knowing about the natural solution. In most cases, the natural solutions, such as essential oils, are also fast-acting. They're affordable, and they're readily available without a prescription. Isn't that nice? So you typically start feeling better and seeing improvement more quickly. And I'm going to give you an example later on in this slideshow of something that happened to me just a couple days ago, and how, you know, just what I did to remedy it. So anyway, your life, your health, you know, it's totally up to you. You have the power. You can be empowered. That's what I love about the essential oils. So, ancient secrets, well, they're ancient, but they're really not too much of a secret anymore. Why? Because many of us are speaking out about them. I'm going to go through 10 of what I want to suggest to everyone on this Zoom call. 10 of the oils that I want everybody to get and to have in your life at all times. Okay, 10 of them. The first one is frankincense. Okay, as you can see, this is, you know, from being the first one that I mentioned, this is the one that I consider the most important. Why? Because this oil literally can help you from top to bottom. If you don't know what to use, this is the oil to use. If you're suffering from any kind of a neurological issue, from brain trauma, headaches, migraines, stroke, dementia, Alzheimer's, the list goes on, Parkinson's, having frankincense diffusing in your home is very important. Also, taking frankincense internally is very important. I use this oil, I don't want to say more than any other oil, because then I always come to another oil and I say, oh, wait a minute, I use this a little more than I use the other one. But I use this oil a lot. So suffice it to be said, this oil should be a normal part of your daily regimen. On Guard, especially at this particular time, and actually all throughout the pandemic, I have been diffusing On Guard. I take On Guard internally. I do it the lazy man's way. A lot of people have the veggie caps and they put a few drops of the On Guard in there. And I'm lazy, and so I have little soft gels, and it has the On Guard there. And so I take it usually every morning and every evening. And I like the way that it makes me feel. I like the fact that, you know, I stay healthy, that I don't seem to come down with, you know, all of those viruses and the, you know, the bacterial type infections very often, if at all. So anyway, On Guard, plus this oil smells amazing in the diffuser. Deep Blue, I'm going to talk a little bit more about Deep Blue at the end of this presentation. However, if you have pain, this is an oil that you definitely want in your life. Not to mention, it smells amazing. Okay, and it could be because of that ylang ylang. I absolutely, anything with ylang ylang is a wonderful smelling oil in my book. But this oil has wintergreen, camphor, peppermint, ylang ylang, helichrysum, blue tansy, blue chamomile, and osmanthus. This oil is amazing. Melaleuca, which is, we now call it tea tree, which, you know, it's the same thing. It's from the same tree, from the same plant, I should say. And it's an amazing oil. I use this oil on my face, on my skin. If I feel maybe like a sore throat, I'll get some tea tree or Melaleuca, same thing, on my throat, along with some lemon. This is a wonderful oil. I love the way it smells. It's very good for your hair as well. I put it in my hair when I'm shampooing. I kind of use different oils in my hair. I use Melaleuca. Then I usually always use peppermint because I love the way it makes my scalp feel. So I use Melaleuca and peppermint one time, and then the next time I'll use like rosemary and peppermint, and then clary sage and peppermint. So they're all very good oils for, you know, for your hair. But anyway, it's also very good for cleaning and purifying. Whether it's the air, you can use it for cleaning your surfaces, your countertops. Lavender, as I had mentioned earlier, very good for burns. This oil is good for any type of a skin issue, whether it's maybe a pimple, a burn, a cut. If you're trying to get rid of scars, it's all things calming. You put a drop on your pillow at the end of the day to help you settle down and to be able to get a good night's sleep. You can rub it on the bottom of your feet also before you go to bed, or you could do what is my favorite and diffuse it. It's a wonderful, wonderful oil. It's also a part of a trio, lemon, lavender, and peppermint, that if you take a drop of each of those in a day, it is actually very effective in helping with seasonal allergies. Then we've got Breathe. Breathe, if you ever smell Breathe, it will take your breath away, literally, because it is so powerful. It opens the airways. If you've got a stuffy nose, sinus issues. It's also a very good oil to diffuse at night because it literally helps to sleep. A lot of people that use CPAPs use this in an adapter, and you breathe it in with your CPAP to keep your airways open, and it's a wonderful smell. Digest Zen. Digest Zen is a very useful oil. Not everybody likes the smell of Digest Zen. It's a very strong oil. It smells like black licorice, very powerful. But it's very literally, you know, you put a couple drops in your hand, you rub it on your stomach, and if you have gas, if you have bloating, if you have pain, it literally helps immediately. If you don't believe me, try it. You can also take this internally. I know my daughter who has IBS, she takes this all the time. Basically, she says she can't live without it. Peppermint, once again, very good for stomach issues, IBS, but it's also very good for opening up your mind. And now what I mean by that is it clears your head, it wakes you up. If you're taking a long trip or something, peppermint is a great oil to take with you. You just open up the cap, take some deep breaths, and carry on. It wakes you up from the inside out. So it's a very good oil, but it's also very, very good for, like I say, for GI issues. I actually just made a blend this morning. I've been rolling it under my eyes. I'm so thankful for being an Italian, but being an Italian, the older I get, the dark circles under my eyes, it's part of that Italian culture, and I'm tired of it. And so this morning I said, well, I'm going to fight it. And so I made up a blend. Peppermint was one of them. There's a bunch of oils I put in there. Let's see, lemon, helichrysum, what else? Tea tree, just a number of oils. So if you want if anybody wants the recipe, I can give it to you, but I know not everybody's got the dark circles like I do. But you know, thanks mom, thanks dad, I should say, and grandma and grandpa. All right, lemon. Wonderful, wonderful oil. It is perhaps one of my most used oils. I have a bottle on the shelf behind me. I have a bottle in my my storage box on the corner of my room. I have a bottle downstairs. I mean, it's like I just use it so much. I make my own lemonade without any sugar. And oh my goodness, you want to taste a lemonade made with doTERRA lemon oil? Let me know, I'll give you the recipe and you will love it. I make my homemade lemonade every morning. And what it is it's my way of detoxification. And it's my little bit of sunshine and happiness in the morning. And boy, does it taste amazing. Very good for cleaning, cleans outside, cleans inside our bodies as well. I call it the Roto-Rooter. It's very good for, you know, if you've got maybe, if you're prone to UTIs, kidney infections, kidney stones, gallstones, very, very good at breaking those things up. Oregano. I could not find a slide. I was actually amazed that doTERRA did not have a good slide for the oregano. But anyway, we'll use this one. This one was also made by doTERRA, but oregano. It's a very, very strong oil. It's also a very hot, well, not very hot, but it's a hot oil. You can actually use it on your hands and on your feet on a cold winter's day, and it actually will warm you up. If you don't mind smelling like a pizza pie. But anyway, oregano, it smells absolutely Italian. But it's very good for, you could rub it on your feet at the end of the day, put on a pair of socks. It's very good for your immune system. Okay, so during the winter months when we're more prone to getting colds and viruses, getting this on your feet is very, very good. But it's also good for other things as well. If you look at the uses, it's very good for to relax the musculoskeletal system. It's good to reduce the appearance of blemishes. It's good for a counter spray. So it's also good. Let's see. Oh, Italian dishes, of course. I've put this in my spaghetti sauce before, but let me tell you, you don't even want to put a whole drop in your pot of spaghetti. What you would want to do is take a toothpick and dip it in there and put that in your spaghetti sauce. Why? Because this oil is very strong. So a little goes a long way. Now, with that being said, these 10 oils are right here in this kit. This is the kit I want everybody to have in your home. Why? Because it gives you the 10 foundation oils that we just talked about. These are the oils that at the very least you need to have in your life. This also gives you a diffuser. This is a wonderful way to get these oils in your life, in your home. You get constant support from me, as well as the one who invited you to this class, but these 10 oils are the oils that literally can replace some of the things that you have in your medicine cabinet that you don't like taking right now. I want to talk just a little bit about diffusers. There are many different types of diffusers that are out there. These doTERRA diffusers are awesome. I can't tell you how many diffusers I go through that I've bought from Amazon or from Walmart. When I get one of the doTERRA diffusers, I've got one right behind me that was diffusing. I guess it must have turned off. But I've got one going right behind me that it has lasted a long time. And so these diffusers are awesome. They put a very good mist out. They're beautiful, they're sleek, they are quality made. They're not very expensive. And you also get, as you look at the very bottom on the slide, PV, there is PV value to each one of these. What is PV value? PV means that if you are on the rewards program, you get free oils. Not bad. If you buy the petal, you get oils with it. If you buy the Lumo, you get an oil with it. We also have another diffuser, well, there's many other diffusers, but one in particular, it's in the holiday collection. I just purchased it. It's actually absolutely beautiful. It's, I believe it's called a Hikari or something, and it comes with a holiday piece, which is amazing. It smells like fir and pine and cypress just all mixed together. It smells wonderful. So If you would like to take some pictures here, these are some diffuser blends. How are you feeling? And you know, if you're stressed, if you're worried, if you're tired, if you're bored, if you're nervous, if you're anxious, this here, I recommend everybody snap a picture of. I have used this a couple times that I know of. I don't have too many problems with my sinuses, but when I do, I don't like it. And so you put, you know, just as the recipe goes here, and it's amazing. It works wonders. Now this, I don't know if anybody's interested in this, but excuse me, they call it liquid Xanax, which, you know, I don't necessarily like dubbing it that, but it's very good for, you know, maybe if you've got children who might have, you know, maybe autism that are maybe, you know, going into aggression, that, you know, needs some settling down. There's a lot of issues that a lot of kids are dealing with now that, you know, we as parents, we can help out a whole lot more. I know there's one particular child that I'm trying to help now, to see if, you know, if there's some way that maybe we can balance out those emotions. It is very true that essential oils help with emotions. All right. Serenity is a wonderfully smelling oil, and balance. And then vetiver. Vetiver is actually, it's a grass. It's grown in Haiti. To them, it's a weed. To us, very, very valuable. So anyway, vetiver is another wonderful oil. It's very good for sleep as well. Putting a drop on your pillow or on the bottom of your feet before you go to sleep. Vetiver is it's a very aggressive sleep aid, actually. It does the job very well. So does Serenity. All righty, let's see. I'm getting toward the end of my class. I have just a few more slides, so bear with me. This is Flume, all right? And so what Flume stands for is frankincense, lemon, oregano, on guard, and melaleuca, which is now called tea tree by doTERRA. But if you put 1 drop of each of these in a veggie cap and down the hatch, this is serious immune support. If you want to get serious with not getting sick, these oils you need in your medicine cabinet. All 5 of these oils are found in that kit that I just showed you. You can take 10 drops of each, put it in a 10 ml roller bottle, top it off with FCO, roll it on your spine, roll it under your arms, which is a good, that's where a lot of your lymphatic system drains. And so it's also, it meets the outside of your body in that way too. For kids, you're gonna dilute it just a little bit more, 3 to 5 drops of each, top of the carrier oil, and voila, you have got your immune support in a bottle. I particularly, I mean, I guess I shouldn't say particularly, I like taking a lot of my oils internally. However, I do take it externally also, so I shouldn't even say that. So just never mind what I just said. All righty, pain management. I want to take just a minute and talk about pain. I've been dealing with pain. I never deal with pain. Literally, I never deal with pain. However, the past couple of weeks, I've been dealing with pain. What happened is I was helping out my daughter, and I was cleaning her bathroom. She had just had a baby, and I was just having a good old time. She had this really, really nice mixture of essential oils and, water in her spray bottle, and I'm just spraying everything down and just having a good old time cleaning, right? And I think I got a little too happy or something. I don't know, but I, just moving around so much, and I moved just the wrong way, and I felt my muscle, whether it was a tear, whether it was a strain, I don't know. But after that, it was a cycle of the inflammation. And by the time last week rolled around, I was helping another one of my daughters with a baby that she just had. Last year was the year for weddings. This is my year for grandkids. And she just had number 4. So I was helping her. And I was holding her daughter, who is very, very colicky. She's doing a little bit better, but she's very colicky. And so, you know, she required a lot of holding. And the injury a few weeks ago, coupled with the stress on my back from holding another baby last week, continued that inflammation cascade. This week, literally, I have not even been able to sit at my desk for very long. I have to move. I have to lay down. Well, what I did, and I'm going to show you what I did, and I'm still in the protocol. So I can't say, you know, this is, you know, 100%, you know, this is, you know, great. But I will say one thing, that I've been sitting here for over an hour now, and I have very minimal, if any, pain. Now I can feel it, but the pain and the discomfort is very minimal. And I'm going to show you what I've been using. It's this Deep Blue right here, that if you wanted to take a snapshot of this, and I'm going to go back to that migraine. I want to show this right here. This is what I'm doing. I have been using Deep Blue. What I do is I literally put it on the largest knob, which would be right here. This is a self back massager that I bought from Amazon. It was very cheap, but it is very sturdy. And it's going to provide a lot of relief in different ways at different times. However, I'm using the large knob right now to target trigger points, and I'm putting the Deep Blue on that knob, and I'm putting about the amount of maybe like a blueberry size of the Deep Blue on that large knob, and I'm taking it behind my back and I'm pressing it in and then massaging it into that particular injured muscle that I'm having. And so far, so good. So I just wanted to share this just in case anybody else is dealing with pain. You know, one of the things that I do understand is that you really can't, you can't sympathize with people on pain until you're actually feeling it yourself. And so, you know, I'm much more sympathetic to pain now, because I literally never feel pain, except for a couple of weeks ago and up to today or this week. So what's in this bottle of Deep Blue, and I recommend every household to have a bottle of this, because you don't realize how much you need it until you really need it. And so this particular bottle sits on my shelf over there with all the rest of my essential oils, and I don't really use it all too much. Why? Because I don't have a lot of pain. Well, I've been using it. And so, like I say, when you need it, you're real thankful that you have it. What's in this tube here? You get a whole bottle of Deep Blue in that tube. Plus you get wintergreen, camphor, peppermint. I'm sorry, what's in the Deep Blue? I'm sorry. Please excuse me. I get a little excited in my head. I don't know where my head is. This particular tube has wintergreen, camphor, peppermint, ylang ylang, helichrysum, blue tansy, blue chamomile, and osmanthus. This oil is very, very important. And I know I did read those ingredients before, but I do want you to understand that this tube goes a long way. It will last a long time. If all you're using is a blueberry size, you know, a couple times a day, this tube will last you a long time. So I really wanted to, you know, give a shout out to this particular oil, just because of what I've been seeing in my own life. Back to migraine protocol, and I'm going to end with this. For those who suffer from migraines, you can go ahead and take a snapshot of this. There are different ways you can do it. You can put some oil under your tongue. You can apply it to the top of your palate. You could put it in a roller bottle. You can take it internally. There are so many different ways that you can actually have this protocol help you with your migraine. Just want to also take note of the ways that you can use essential oils. Now, most essential oils you can use aromatically. Most essential oils you can use topically. Most essential oils say do not take internally. So if you want to take your oils internally, you got to use doTERRA, because doTERRA is proven to be safe to be taken internally. That's why they're a little more expensive than some of the other oils, because they're not mixed with anything synthetic. They are not adulterated in any way. That's why doTERRA can tell you to take them internally. So you can put them in your beverages, you can put them in a veggie cap, you can just put them under your tongue. You can use the doTERRA supplements like I do because I'm lazy. You can put them in recipes, right? You just gotta be careful. And you have to know that there are some doTERRA essential oils that must never be taken internally because of the types of plants or trees that they come from. There are many of the hardwoods that are not to be taken internally. So here's a list right here of those that are safe to be taken internally. The safety, be very careful not to get the oils in your eyes. That's very important. There are protocols that you actually can use in your eyes, but that must be done very carefully, as well as your ears and your nose. There are some protocols that you can put them in those areas, but that must be done with a lot of care. Some of the oils are better used diluted. For an example, I don't ever put peppermint on my skin without being diluted. And not that I had a sensitivity, but my daughter had a sensitivity to peppermint. Other oils such as clove or cassia, hot oils, got to be careful with putting them on your skin without diluting them with some type of a carrier oil, such as fractionated coconut oil, almond oil, jojoba oil, olive oil, right? There are some oils that will increase sun sensitivity. Those oils would be bergamot, lemon, grapefruit. A lot of the citrus oils are like that. Store them safely. You don't want them to be in the direct sunlight. I keep mine in a wooden box. And of course, always be careful when you have little children. Keep the oils out of their reach. There are oils for children, and there are oils that can be made for children. But you just want to be careful with what you're giving to little kids. I do want to make sure that I get this in, because when we're talking about health from A to Z, we have to talk about supplements. Okay, this is part of your diet. This is part of my diet, and I have been very satisfied with the results that I've gotten from Lifelong Vitality. This is a supplement regimen. You take the XEO Omega, the Alpha CRS, and the Microplex VMZ. And if you look at all of what they do and what they help and how they support, this is something that everybody should be on. If you have a young child, or if you yourself cannot take pills, if you can't swallow them, we also have the doTERRA vitamins in a child strength and in a chewable capsule. All right, Healthy Essentials Kit is another kit that you can purchase. It gives a couple different, it's got most of those 10 foundational oils, but it also gives you Copaiba, Balance, and Adaptive, which are very good for any type of neurological support that you might need if you're dealing with maybe such as stroke or some type of a neurological issue, Parkinson's, autism, it could be depression, bipolar, schizophrenia, anxiety. This is a really good kit. If there's any type of a severe or traumatic brain disorder, this would be a good kit to get. The diffuser is larger, the bottles of oil are larger, and so anyway, this would be a good kit for that. I wanted to give some credit to this particular website for much of my content for today, and I am going to go ahead and stop sharing, and I am also going to